staff working in those environments where they have to be using a flashlight to diagnose if there's air outside of the lungs. You're setting them up for medical legal issues. Nobody wants to put their degree at risk. Nobody wants to sacrifice their careers for delivering substandard care. And it's very difficult to have to keep on telling parents why their babies died when you know that because you can't get back results, because you can't make a decision, because you don't have the tools to treat them. You're watching babies die because of late diagnoses, because urgent medical issues become emergency issues, and with a higher death rate. It's not acceptable.
We're wrapping up a discussion with Dr. Alfred Dawes. He's the opposition spokesperson on health and wellness, and he's been talking to us about his concerns about reports of the death of 24 newborns in June at the Victoria Jubilee Hospital, which is the Caribbean's largest specialist maternity, English-speaking Caribbean, largest maternity hospital. And I wanted to ask you, Dr. Dawes, appreciate your patience. Thank you so much. We hear Sarah saying that they are conducting an investigation, and they said that will guide any interventions. Tell us for you a public health epidemiological investigation. Sorry, not laughing at it, laughing at myself. Yeah, what do you want to see come out of that investigation? What for you is critical?
That investigation, it is just an attempt to placate the public and to stem outrage. How many babies died in December last year? How many babies died in September last year? Sarah needs to make those two data points public. Did they have any investigations at that time? Because those were two outlier months where the death rates were very high, but there was no public outcry. Had they done the necessary investigations back then, could it be that they would have prevented the deaths of so many of these babies that we're now talking about now? We have to remember these are not statistics. These are babies that were carried for sometimes up to 9 months by mothers who are now grieving. Their families who are grieving, they are expectant mothers now who are worried because the condition, it's not like it's an outbreak of a virus or bacteria where you can say you fix it and things are back to normal. These are conditions that exist and will continue to exist until the political will is finally taken to fix the situation. So I'm not going down that road to say that we must wait on the results of the investigation. That investigation should have been triggered from last year when they had the issues. We had a dead baby scandal just before the 2020 elections. Questions were tabled in Parliament. The minister had dodged the responses that were required of him. And then we went into an election and everybody forgot about it. And then it was business as usual. Nothing came out of it. All this is PR and nothing more. And Jamaicans need to understand that enough is enough. This is something that we have been talking about from the PNP administration. At that time I was called a Labourite, and now they're saying that the same people who were championing my cause back then are the ones now trying to discredit and brush aside and obfuscate the data. And it needs to stop. We cannot be in a position as we were 10 years ago, and it's worse.
All right.
So what they're saying is just not going to placate anybody. There's enough outrage there. And I'm going to ask this question. In 2015, with 18 babies dead over the span of 3 months, over 2 hospitals, opposition leader Andrew Holness called for the resignation of the Minister of Health. Now we have 24 babies dead over the span of less than a month in one hospital. What is Prime Minister Andrew Holness saying about the tenure of his Minister of Health?
Gonna leave it there. We appreciate your time as always, Dr. Dawes. Thank you so much.
Always a pleasure.